Hello everyone, this is Dr. Jawad. In the short video, I'm going to talk about how I work with a lot of patients. The key is what exactly is causing the inflammation in your body. So the 5 causes of inflammation. Okay, now in no particular order, but the key thing is to find what exactly is the causation of your inflammation. So first and foremost, hormones. Now the hormones, cortisol. Cortisol is the anti-inflammatory hormone released by our adrenal glands in times of stress, in times of injury, so forth and so on. So what do they give you when you go to the doctor because you have decreased cortisol? They give you prednisone. So prednisone, again, is one of the cortisol release could be one of the reasons why you're inflamed. Next, insulin. Now, insulin, what happens with too much insulin in the body, okay, especially if you're taking in too much sugar, that causes inflammation. And if you have too much sugar flowing around the body, you have a condition what's called insulin resistance, which is a pre-diabetic situation. Because what happens is if you just have too much sugar and the pancreas decides to shut down, okay, now you're type 2 diabetic, and again, too much insulin will cause inflammation. Next, gallbladder. The gallbladder is a phenomenal organ. It's located in the right upper quadrant, about a fist underneath the rib, and the main function of the gallbladder is to store and concentrate the bile made by the liver. Now, what is bile? Bile helps break down fats for utilization, okay? Also, too, it helps lubricate the colon. So, what happens if you have a dysfunctional bile? The bile is needed to absorb fatty acids, and fatty acids are anti-inflammatory. Many times when you go to the store and you buy, again, omega-3 fatty acids, the omega-3 fatty acids are anti-inflammation, and without poor gallbladder function, you're not going to absorb it. Also, too, a lot of stuff I deal with patients that if they have any right-sided pain, fibromyalgia, for example, I get my patients on the table, I bring their knees up, and I just really press down, do an acupressure point on the gallbladder. 9 times out of 10, the pain from fibromyalgia goes away. So if you know it's that, okay, the pain goes away, then you know that you have a bad functioning gallbladder. And I always recommend for that situation, any type of gallbladder support, Biomin, anything that's going to help, bile salts, anything that's going to help stabilize or increase the function of that gallbladder to break down the fatty acids, because the fatty acids are needed for anti-inflammatory. Next, old injuries. Now, I've had a history of sprained ankles. I'm nursing an injury here on my elbow from lifting, because old injuries, what happens? It creates scar tissue. And anytime you create scar tissue, you reduce the lack of motion in that joint space. 1, 2, scar tissue, actually, our body is an electrical system. It decreases the electrical conductivity of the muscles in of itself. So you have poor muscle function in that area. So how I work with patients, and again, just try it, okay? Work on the opposite side of the injury, whether it be your elbow, like in my case, a wrist, a shoulder, definitely shoulders, back, butt, knees, so forth and so on. Work on the opposite side. Massage it, work it hard, okay? So just trust me on this. It does work. 9 times out of 10, it does work, okay? Next, very important, vitamin K2 and vitamin D3, okay? Because what happens when we have injuries, we have increase in soft tissue calcium in the joints of the body, hence scar tissue, bony spurs, so forth and so on. The problem is that yes, we need calcium for muscle function, nerve function, and body function. However, too much calcium buildup causes inflammation because calcium is excitatory. Now, I always tell my patients this, pair it up with vitamin K2 and vitamin D3. Because vitamin D3, what that does, it actually pulls calcium into the bloodstream, okay? But vitamin K2 is very important. Vitamin K2 pulls the calcium from the bloodstream actually and into the bones and teeth where it should go. So it decreases the soft tissue. It decreases the brain. It decreases in the eyes as cataracts. It decreases the bones as, again, bony spurs. So try it. It definitely will work. The next, food allergies. This is very important, okay? A lot of people don't understand that we have food allergies that cause inflammation, okay? And one of my recommendations always is when people come to my office and they talk about they're inflamed, I always ask them, what'd you eat? What'd you eat? How did you feel after you ate? Okay? Now, for me in particular, I love cantaloupe. I love cantaloupe. The problem is, I realize this, cantaloupe doesn't agree with my stomach. Okay? And I paired up the two and two together because usually about 45 minutes to an hour after I eat cantaloupe, my stomach is just not agreeing with me. Gluten is a big one. Dairy is another. Gluten and dairy, with soy, nuts, eggs, cause inflammation in the body. It causes a condition called leaky gut. So again, my recommendation with the patients is do a food log, do a food diary. State how you felt after you ate this particular food, because you may never know what you're allergic to or even sensitive to that will cause inflammation. All right, so again, here's the 5 causes of inflammation. The key is always what is causing the inflammation, and then once you find out the cause, remove it. Very simple. All right, hope you enjoyed the video. I'll see you in the next one. Take care. Hello, this is Dr. Jawad. Please subscribe to my channel for more up-to-date videos, and thanks for watching.